Et on poursuit nos réflexions donc sur l'innovation e-santé, la manière d'évaluer la e-santé, de capitaliser sur cette innovation, qui doit évaluer, comment, quelles bonnes pratiques en la matière, comment le lien peut-il être fait aussi avec la recherche universitaire. Alors pour aborder ces questions, on va me rejoindre tout de suite Mathilde Forslund, qui est directrice exécutive de Transform Health. Voilà, venez me rejoindre Mathilde. Et on peut applaudir parce qu'elle est venue de loin, elle est basée à San Francisco. Elle nous expliquera Transform Health, c'est un regroupement d'organisations qui sont investies dans la transformation digitale de la santé à échelle mondiale. Fuad, qui vient aussi de très très loin, de l'autre bout du monde cette fois-ci. Il est chercheur au Centre de politique et gestion de la santé à l'Université de Gadjah Mada à Java en Indonésie. Merci infiniment d'être des nôtres. Je sais que les choses ont été compliquées pour arriver jusqu'à Toulouse aujourd'hui. Vous êtes également membre du comité de direction de AeHIN, le réseau d'information sur la e-santé en Asie. Peut-être voudrez-vous un casque de traduction, si on peut en apporter un pour Anis, pour qu'il arrive à suivre cette table, sinon il va être un peu perdu. Avec nous également, on a la chance de l'avoir en duplex depuis l'Inde, depuis le Rajasthan. On parlait tout à l'heure de son projet. C'est Mohammed Shahnawaz qui doit être en face de nous. Mohammed, si vous nous entendez, il est CEO de Khushi Baby, dont on a parlé il y a quelques minutes, et on est très heureux de le retrouver. Il est en face de moi, s'il nous entend, depuis l'Inde, à Udaipur, précisément, dans le Rajasthan. Mohammed, est-ce que vous nous entendez? Alors, je suppose qu'il est en face de moi, mais je vois également 2 sièges vides. Donc, je ne sais pas s'ils sont partis quelques minutes, s'ils se sont absentés. On va essayer de les contacter si quelqu'un peut me dire si effectivement ce sont les personnes que je vois à l'écran ou pas, puisqu'à ses côtés doit se trouver également le docteur Jitendra Kumar Soni, qui est directeur de la mission au département de la médecine, santé et protection de la famille au gouvernement du Rajasthan. On les retrouvera, je sais qu'on a la liaison, on va les retrouver, voilà, on est parti les chercher, on va les retrouver d'ici quelques minutes. Le temps qu'on aille vers l'Inde et qu'on me fasse signe de savoir si c'est bon ou pas, on va accueillir également autour de cette table Iveth González, qu'on peut applaudir, qui est directrice adjointe du programme santé à l'ONG Terre des Hommes, qui est située en Suisse, et qui gère entre autres parmi ses nombreux programmes Mada, que l'on a vu tout à l'heure. Anis, Fuad, vous me disiez que l'évaluation, puisque c'est le thème central de cette journée, devrait être intégrée dans n'importe quel projet de santé digitale dès le départ. Pourquoi est-ce que c'est si important? Est-ce que c'est réellement le cas aujourd'hui?
Thank you, Lionel, for the questions. I think before I start to answer the question, I enjoy the former discussion that provide a lot of real experience. Sorry. A lot of experience that currently in the world there are many implementations, and I think the evaluation is becoming more and more important currently, not only from the perspective of the government, we heard a lot about this, but also from those implementers, the ONG, and also several programs also from the universities, but also from many institutions that provide the support, international organization. So I think it is becoming more and more important, and currently the demand of the patient itself, the demand of the community, because if there is any new intervention without evaluation, they could not feel whether the impact is also coming to them. So I think it is not only about the fact about the number, but also the real impact to the community. It is very important right now.
À Nice, aujourd'hui, vous insistez beaucoup sur cette importance, mais quel est réellement le pourcentage de projets
Now, how many projects are assessed? What is the percentage? Are we talking about 10, 20, 50% of projects are currently assessed?
Yeah, I think I would like to start with the current situation in my country. I am from Indonesia, and Indonesia is, like mentioned by Jay in the presentation, it is a country, even though it is the place that there are many startups is currently right now implemented in the country. There are many optimistic number about the potential of the startup in the country, and also the increasing budget from the country implemented for e-health. But to say the number is in Français is very complicated. It's the number is not there. So I think it is the time that there are many participants from around the world. We start together to have a standard method to collect the data and then to measure the impact. So several data, as in my country, is available from the small scope. But in a number, in a country, it is very difficult to collect. It is also about how to bring awareness to the, for example, research institution. They need to report if they provide a result and give impact to the community. Several methods, for example, scientific method should report, for example, from the beginning. They should provide the procedures. They should provide the protocol. And finally, the impact. So I think it is the time that not only the implementers from the government, any implementers from outside of the government should start to collect the number of impact right now.
Ouais, on sent bien l'importance aujourd'hui grandissante de cette évaluation. On la met peut-être en corrélation avec des chiffres aussi financiers qu'on a tout à l'heure, d'investissement dans les projets de santé digitale. L'un va avec l'autre. Je suis un peu désespéré quand j'entends que les premiers mots en français que Anis a retenus, c'est très compliqué. Bon, ça c'est une parenthèse que je me permets de fermer. Mathilde Forslund, vous qui nous arrivez de San Francisco, peut-être tout d'abord un mot rapide sur Transform Health. C'est quoi comme organisation et c'est quoi le but?
What is this organization? What is the purpose?
Yeah, sure. So my name is Mathilde Forslund. I want to say thank you so much for the invitation from PFAB Foundation. It's been really wonderful to be part of this today. So my name is Mathilde Forslund. I'm the Executive Director of Transform Health. And for those of you that don't know us, we are a coalition of organizations that was founded about 2 years ago in 2019. We are a coalition of about 50 organizations. We've grown quite rapidly. And we were set up by 7 founding members in 2019. Our focus is on advocacy and campaigning for stronger political will, which we've heard a lot about today, which is really a very important aspect. And then we also campaign and advocate for a global health data governance framework, which Jai mentioned earlier, which is really crucial to the work that we're doing. And the third aspect is increased and coordinated investment for digital health. So we focus on really the broader enabling environment and the incentive structure that shape the way that digital transformation are deployed, adopted and adapted across different contexts. And I think many have mentioned this here today. There's really an inability or really an unwillingness of many governments to deploy the right policy, regulation, legislation, and funding environment that would enable, digital transformation to happen. So this is really central to the work that we're doing at Transform Health, and we believe that the reason that we cannot achieve digital health transformation and scale digital health transformation is really it's not technological. It's actually political. So that's really what we believe that we need to invest in.
Passionnant parce que vous nous expliquez effectivement cette grande règle que l'on a peut-être oubliée en se lançant parfois comme des fous dans la digitalisation.
Sometimes we've forgotten some of these rules when we start digitalization. I think that we need an environment. I think that we have a problem with the sound. Very sorry about that, says the interpreter. So we need a completely secured environment, a stable environment, if we want to be able to assess a project. Now, you've been working with WHO and with 6 target countries. Now, what is the goal? Because you want the 6 countries, the same environment, stabilized environment, the same rules in the 6 countries?
Yes. So our goal is really to build up these national coalitions and to start to really advocate for that enabling environment. So the right legislation, the right policies, the right regulation for digital transformation to happen. And the way that we do that is not by us implementing any of this ourselves, but really to build up these national multi-stakeholder coalitions in different countries, in the 6 priority countries, which is Indonesia, Kenya, Senegal, India, Mexico, and Ecuador. And to really, empower and have them build up their own national coalitions to drive this agenda forward.
Extrêmement important là aussi ce que vous nous dites sur ces 6 pays d'évaluation, la nécessité d'avoir un cadre
This means that we
parce que
really
l'évaluation,
need
elle est
a framework because we have the
les acteurs sont
multifactorial
on a bien vu dans les
situation, and we've
forces
seen
des projets qui ont réussi tout à l'heure, les
previously
projets
that
qui arrivent
if
vraiment à
a
se développer
project
sont
is
des projets où à un
successful, it's
moment
because at
les
one
ONG ou
point
les
in
entreprises
time,
travaillent main dans la main
NGOs
avec
and
les
companies are
gouvernements.
working shoulder to shoulder with the government, and I would say that this is a very exclusive condition or pre-requirement. Now, what about you've been doing with the governments? I think that everyday governments are being approached by start-uppers, by e-health developers, but they don't have the tools they need so as to choose the appropriate project. Did I understand right?
Yeah, sorry, the translation is a bit behind. So what we have been doing, and I'm going to speak specifically to the investment case that we're working on at the moment. So we are advocating for increased and coordinated investment, and I think this has been brought up here many times today. For the equitable, inclusive, and sustainable digital health transformation in LMICs. So we really face a number of challenges at the moment. The first one being that some countries have the funding to invest in digital health transformation, but some countries do require international donations or investments in order for them to build their digital health strategies. Another issue that we're facing is that countries and external stakeholders have really begun to step up their investment in digital technologies, but many investments have so far been very short-term, have been, kind of invested in solutions rather than kind of a systems approach. Another issue is as well that we have, there's a lot of transaction costs on health systems, particularly on healthcare workers with this kind of pilotitis that is happening. And then another issue is as well that policymakers really lack the information or even the understanding of the overall needs and demands for digital-enabled healthcare and healthcare services. The other issue is that obviously investors who choose to invest in digital health, they don't know which solution to invest in because often there's a multitude of investments. They don't know, and governments as well are very confused to which one they should choose to invest in. So this is why we must address this issue and increased investment and coordinated funding to ensure that we have a more sustainable systems-wide approach to at the national level. So in response to this, we have been working with Transform Health with its partners. I mean, we have a rather big network of organizations, including the Job Lange Institute, PATH, Digital Square, and many of the regional networks that are here, including AeHIN, Helena, and others, that have been working on this kind of conceptual framework for an investment case that we're going to launch at the World Health Summit in Berlin in October.
Mathilde, très rapidement dans la nécessité.
Now, I would like to ask you, Mathilde, when you have this you want to try to coordinate all this policy and this framework, I would like to ask you if there isn't a risk, because that means that I would say that the governments, for instance, wait to have a stable regulation and also framework before they launch their digital health policy, and the GNOs, for instance, or NGOs, sorry, are going to wait for the regulation too. So if everybody waits for everybody, what's going to happen?
Yeah, I mean, that's a really good question. I think the role that we have is to represent the voice of the unheard and unrepresented, and to really bring the agenda of people to the table of governments, right? So to represent civil society, and we heard a lot about equity and human rights perspectives, and I think that is really what we need to serve up to the government and really make sure that the needs of people are being addressed, by governments and in the decision making.
Iveth González, pour vous qui êtes chez Terre des Hommes, qui est en charge entre autres des projets des opérateurs sur le terrain, principalement en Afrique, est-ce que la question de l'évaluation, de la recherche aujourd'hui est systématiquement ou pas tout à fait encore systématiquement?
I would like to know if research is systematically embedded in the project.
Merci beaucoup pour l'invitation pour être là.
Well, thank you very much for this invitation and thank you for the presentation of the project AeHIN with Terre des Hommes. Yes, I would like to say that the organization like Terre des Hommes, well, we can't really have an approach based on assessment. It's not systematic. Why? Because our priority is to be able to develop our activities so as to help people who need us. That's really the priority of Terre des Hommes. Now, the issue we have is that we have a different mindset. And there is a different mindset because we've been there. We've been trying to support this approach. We wanted to improve the quality of the healthcare. It's very important to see what's going on in the field so as to improve what we've been doing. The other challenge is to be able to scale up our projects, and we also have to assess the quality of these projects, which very often are pilot projects, and then scale them up. And the third priority or challenge is to be able to see how we can embed this project in the policies which are currently being adopted, and how can these policies change? How can we base what we do on operational research in the field? Because this gives us evidence, you see, and this can help the decision-making process. Oh, well, thank you for this. I think that you're convinced that assessment is important, and you know that the donors and the governments are expecting reports from you. But you say it's not a priority. It's not obvious because our operators, people who are in the field, are trying to answer, to meet the needs and the expectations of people who need them, and they're not there only so as to provide reports to the governments and so on. So do you agree with the statement? Is that what you really said? Yes, this is obvious. I've said, but even the donors feel like that, not only us and Terre des Hommes, because we have donors who are really involved in this kind of project like Terre des Hommes, and they don't want to invest their money, for instance, in reports and Excel tables and so on. But I think that we have today a small group of donors for whom our interventions, our actions are essential, and therefore they are funding us so as to be able to have these assessments. But having this kind of audit and assessment is very costly. You do this usually with academic partners, and you have to invest money, and you need the money. Now, I want to make sure we understand what you mean by assessing what is going on in the field. When we started preparing this roundtable, Iveth, you told us that there was a program concerning pregnant women in Mali, and that you've been testing this project. Now, it's not easy for the operators working in the field, because what kind of assessment can you really develop? How does this work? Answer. Well, I think that we can speak of a real challenge when you have this kind of assessment in the field. It's the experimental design of the assessments which is the real challenge. Because how can you have an assessment of what you're doing in the field? You have to start doing this at the very start of your project. And you have to see how the project is being developed, is being rolled out, what is the impact in the field. And for this very specific example you have mentioned, we've been working with the Johns Hopkins University for the design of the assessment, and we wanted to have an assessment, case control studies. That means that we have selected, we have chosen a small village where we have a first initiative and another village where there was nothing done really, and we've benchmarked all this. Now, what we wanted to do was to benchmark the digitalization of antenatal and postnatal consultation for pregnant women and women who had just given birth. And we wanted to see the difference between the location where you have the electronic tool and where you don't have it. And we've been able to see that the electronic tool can improve the added value of the service. But this also faces us with ethical problems. Yes, I
la mortalité des enfants. Et puis ce village entièrement, on va pas les aider, mais on va aller voir s'il y a plus d'enfants morts dans ce village, parce que c'est ça aussi l'évaluation.
Après, je vois le travail de
This
santé.
is not really how people react. People already react like that because they don't have tablets, some have tablets, some have iPads. Of course, people feel a bit bewildered, but that doesn't mean that we don't help those people or those villages where we don't have the electronic tool. What I'm saying is that when we start setting up the electronic tool in some villages, we want to know what the bias is when you have an assessment, okay? In the villages where you don't use the tablet, well, you still have an intervention and you still try to improve the quality of the healthcare services. You have the whole process of observation, you have supervisors who are here so as to collect the data, okay? We do it, but we have some biases, and therefore we have to take into account these biases. So it's not easy, and this is why we need the electronic tool sometimes. The message I want to convey is that it's not easy to have an assessment of what we're doing in the field, and therefore we need skilled people, skilled team, and we also have to do this with the academic environment, experts who are in the field of operational research, so as to have at hand assessment tools which are really effective.
Je me tourne vers un autre continent, vers l'Inde à présent, où je vois du monde à Udaipur, dans le Rajasthan, qui est en train de nous suivre en direct. Là, ce sont les personnes normalement en charge de Khushi Baby, Mohammed Shahnawaz qui devait être là. Qui est-ce qui est présent avec nous aujourd'hui depuis l'Inde pour cette conférence?
Actually, Dr. Jitendra from our Soni, who was supposed to join us in this conference, is unable to join, so sincere apologies for that. On behalf of him, I am Gadjah Sharma, co-director of Khushi Baby, is going to present. So we can have discussion.
Voilà, je vais essayer de vous poser. On a un tout petit problème de liaison et de son qu'on va essayer de résoudre. Je vous pose, ceci dit, notamment la question sur Khushi Baby. Aujourd'hui, comment assurez-vous l'évaluation de Khushi Baby et qui demande cette évaluation? Est-ce que c'est principalement le gouvernement du Rajasthan?
I would like to hear this conversation in English, if possible, please.
Voilà, je vais vous reposer la question et on va voir. Si on a trop de difficultés de son, on va vous retrouver d'ici quelques minutes. Je vous posais aujourd'hui de manière concrète, comment faites-vous l'évaluation de Khushi Baby et qui demande cette évaluation? Est-ce que c'est le gouvernement du Rajasthan?
I would like to get this translated in English if possible from your side.
Ce que je vous propose, on va régler les petits problèmes de liaison avec Udaipur et j'espère qu'on va vous retrouver correctement d'ici quelques minutes pour parler de cette évaluation de Khushi Baby. Iveth, j'ai envie de vous poser les mêmes questions sur des projets comme Yeda ou d'autres projets. Aujourd'hui, finalement, qui demande à évaluer? Est-ce que ce sont principalement les gouvernements, principalement les bailleurs de fonds ou des organismes mondiaux type
World
Hommes
organizations like the Health
l'évaluation?
World Organization? Who's asking for this?
Ça dépend.
Answer. Well, it all depends because it can change from one project to another. But for us as project developers, assessment is really an essential phase because it is essential for the certification and the quality of our project. So we have a specific department or division where we have an assessment of all the projects we propose. But we also have donors who are asking for the assessment. It's very important for donors to have an assessment of the project. Of course. Who? Can you give us an example? Yes, I'll give you an example. The Bill and Melinda Gates Foundation, for instance, have asked for an assessment. They're very much involved in the research field or sector for our projects. And we are also in contact with the academic environment. They're also very much involved in the academic world and environment, so we work with them, and they need the assessment. Now, what about the Swiss government? Because the Swiss government, I think, is funding most of your projects. Are they asking for a specific audit? Yes. The International Development Department of Switzerland is one of our major donors, and therefore, yes, they're asking for this kind of assessment. Now, one of the main questions or issues we have here is that now, how can you assess a project? Because there can be very many different ways of looking into a project. Do you think that a donor like Bill and Melinda Gates, the foundation of Bill and Melinda Gates, is going to have the same approach or not? No, I think that we are very independent. Well, and there isn't any conflict of interest when we ask someone to fund our project and when we have to assess the project. So I don't think that there is a great difference between the different people who are appreciating the project. The differences appear in terms of impact of the project and also the capacity of our teams to respond to the needs in the field. And as we've said with Philippe Lepere, we need financial economic audits and assessments, and this is one of our weaknesses, I think, because we don't have enough assessment in this field. But I would say that we also have to look at the people, at the end users, the people who really benefit from the project. This is the most important part, I think, of what we're doing. It's very important for us to collect the data and see if people accept what we're doing, if we're really compliant with what we do. You've been saying something concerning the relationships with the Gates Foundation, and you've said, well, we have a rather positive and good relationship. Now, do you think the donor is the person who can really, most relevant person who is going to work with you? Don't you think that there are biases also among the donors, especially when you work hand in hand with a donor or with a government or with an entity, whatever? Answer. Well, I think that the research protocol is set up with the academic world or environment, and then the criteria are defined with the research people, the universities and so on, but not with the donors. And there's no interest conflict, because what's really interesting is what we do in the field. No, I'm not speaking only of interest conflict of interest, but I don't know. I would like to ask Mathilde how she feels about this, because no, but first, says Iveth, I would like to insist on the fact that what is interesting when we have this kind of assessment, operational assessment, that is to say, who is going to be benefiting from what we do? Is it, and I think it's the government who's going to use the results to take or to make political decisions, you see. I think that would be now, Anis, I think you work in a university, and I would like to ask you how to feel about this. Is this the university or the academic world really relevant to say something, that is to say, to assess what's going on with donors and other people?
Yes, I think it is interesting questions. As we know that in university, we learn a lot about the scientific foundation of any implementation. For example, there are more than 100 theories on information systems. We can evaluate whether from the usability perspective of the users, and also whether the impact financially, or whether feasibility of any innovation to be applied in other settings, and also to evaluate from the efficiency or efficacy. So there are several perspectives, and there are many experts. One expert, for example, on digital health economic evaluation probably are not strong compared to those from the usability perspective. So I think from this aspect, we need also to learn that universities, experts, even though they have many foundation scientifically and also theories, they have a different perspective. But for the implementation, the statement of conflict of interest are very important. Sometimes universities are also involved on the design of any intervention by the government. So if this is the case, so I think, for example, for the evaluation, should not be the same universities to conduct the design and then evaluate as well the intervention. So I think when Iveth mentioned about the conflict of interest is also very important. And also sometimes at the government, they have also the research units. So research unit at the government also need to provide conflict of interest during the research. So currently there are many approach on how to get independent research for any interventions, and also increasingly right now the coming of data. For example, when people using the mHealth apps, the data are coming every day, either from the review of the users or the data collected. It is also another sources of evaluations. So combining all are also very important, and also from the perspective of the university, it is also important to introduce the concept to the research team, also students, because students are also everywhere to need this kind of intervention for evaluation, for research, and also for studies. So collaboration with the universities are also very important. The statement of interest also important, and also the how independencies of the universities during any research.
Mathilde, vous vouliez réagir sur cette question qui est fondamentale finalement.
Mathilde, you wanted to react on that. So who assess who's better placed? What are the criteria? And as Annie said, there are as many experts and point of views as topics. A political leader is not going to have the same point of view as a scientist. A healthcare professional is not going to have the same point of view as an ONG leader, NGO leader. So you try to coordinate players, right? Can we have a common framework?
Yes. So I think without risking not getting any funding in the future, but I 100% do think that there's a lot of issues in the funding landscape, and there's a lot of political motivations behind funding, right? I mean, I don't think we should stick that under the table. But I do think that, and the way to overcome that, I would say, would be to empower communities to really make more decisions of where funding is going, and the way to do that is by creating more political demand on from the bottom up, from people, from society, to really demand that their issues are being addressed, when it comes to health. And I do think that the only way we can do that is by creating a kind of a movement among the general public to say health is really important. These aspects of health are really important. Digital enablement is really important because of this and that. And so I think this is really what we need to invest in. Then I think when it comes to the way that we fund digital health, this is another really important thing, and this is something that we're also pushing, that we're hoping to push through the conceptual framework that we are developing and this investment case that I was speaking about. We do need to establish new kind of parameters of how funding is distributed. And so with that, I think we need to have, we need to look at existing modalities of funding, and are there, ways that we can coordinate funding better, but also ensure that there's democratization around funding, so that, it's not coming from a few countries of the global north, but really that the decision of how the funding is being distributed is taken at every level, including in LMICs. I think that's very important.
Anis, j'aimerais bien que justement que l'on revienne sur ce que nous dit Mathilde, aussi qui est fondamental pour qu'un projet finalement puisse émerger, passer à l'échelle, se développer. Il nous faut à un moment une utilisation massive. Pour avoir des utilisateurs, il faut que les gens s'y retrouvent derrière. C'est l'un des paradoxes souvent de l'évaluation, c'est qu'on oublie de demander leur opinion aux premiers utilisateurs, on oublie de les impliquer dans l'évaluation de projet. En marché privé, on parlerait parlerait de
feedback on
l'expérience
the private
client. Quelle est
market, you would
l'expérience
talk
client,
about the
l'évaluation par
customer
le client?
experience.
En
Do
santé,
you
on parle de
assess the
patients et moins
end
de clients, et
user
on lui
of a
demande souvent
patient
moins son
point of
avis.
view?
Est-ce que les
Quite
choses sont
often
en
we
train de
forget to
changer
ask
sur
them
ce
that.
point-là, à
Is it
votre avis?
something that's currently changing?
Yeah, I think the issue about the evaluation from the perspective of the users, and also the evaluation from the perspective of either the implementers or either implementation from developed countries to be applied in other countries. So I think there will be some consideration or discussion. I think what we heard before, any implementation should start from the condition. What are the problem in the real settings? So the problem in the real setting will be felt by the real users. Either the users are clients, are patients, either the users are carer, nurse, midwives, or doctors, either the users are those on managing health system. The setting are sometimes is very different from one to another. Many examples in Indonesia, for example, a digital health innovation applied in Java in urban area, it is not easier to be implemented in rural area, especially in the remote one. And second one is also important about the technologies. Technologies in the developed countries sometimes is very different to other countries. It is also related to the maturity of the infrastructures. And the third thing is also very important is the value proposition. Whether the value propositions, either from the providers, from the perspective of the economics, from the perspective of the results on the health, for example, the impact on the community, it is also sometimes also different. I think this kind of identification, assessment from the beginning are very important. Before then, we discuss about more general and also wider aspect from the perspective of organization, regulation, and also health system. There are also another issues, but from the small scope as well, I think we need to start for identification about any implication of any digital innovation to be applied in other settings.
Ouais, embarquer tout le monde, les patients, les soignants aussi dans cette évaluation, ce qui n'est pas toujours si naturel dans les organismes de santé qu'on soit au sud comme au nord. Là-dessus, personne n'a de leçon à donner à quelqu'un d'autre. Je me tourne à nouveau vers le Rajasthan, vers Udaipur, puisque je vois qu'il nous écoute toujours. Udaipur, can you hear us well this time? And who is listening to us in Udaipur today?
Hello. Hello.
Hello. Can you hear us? And who is listening today in Udaipur?
Yeah. I am Ajay Sharma, co-director of Khushi Baby. I am talking on behalf of Dr. Jitendra Kumar Soni, IAS Mission Director, Government of Rajasthan.
We are so glad to hear you today here in Toulouse. We are talking about evaluation. So could you tell us more about the evaluation of Khushi Baby? Who tries to evaluate it? The government, the NGO, the donors. How do you manage your evaluation?
Yeah, actually, it depends on project to project which we carry out. In some cases, the evaluations are conducted by the third parties. For example, recently we had an evaluation of a global project that was conducted by an external party. So for the government, in the case of government, we ourselves provide the evaluation for the project. For example, we provide entire analytics for the project which we undertake in the state of Rajasthan to provide them insight on the project, what is going on and what is happening actually. So it depends on project to project. In some cases, the internal evaluation goes on, and in some cases the external evaluation goes on.
What is the most important for you in evaluation? I mean, is it a political evaluation? How many people did you reach? How many families? Or is it more an economical evaluation?
Actually, for us, it is both kind of evaluation are important for government to understand the scenario. For example, qualitative. In the case of qualitative, we can say the government would like to know what is the scale of the project and where the impact is going on. In that case, the qualitative evaluation is important. To understand in depth, we also think the qualitative evaluation is also important. To understand any study in depth, the qualitative evaluation is very important.
I know that something else is very important for you. You like to empower the people in the project and in the evaluation, and you often say that the main people that evaluate your project every day are the patients, the family, and the health workers. How do you do to empower all those people in the evaluation, in the design of the project too?
So while designing a project, actually to empower, especially when we talk about the health workers, we generally, after having an evaluation of an ongoing project, we just come up to the challenges what we have faced in terms of scaling up of a project, for the adaptability issue first, and then to scale up. So we try to understand what challenges are coming up with the existing health workers to get the adaptation of the digital health platform while switching from traditional paper mode to digital media. So having a, you can say, the qualitative and quantitative evaluation helps us to understand the challenges they are facing to get the scale up. For the policy level, our evaluation makes some help to understand where the challenges are and what challenges, how we can cope up with those challenges, basically.
When we talk about evaluation, there is also a main question about it. Who pays for the evaluation? Is that the government that pays for Khushi Baby? Do you pay on your own funds for evaluation? And did you have a budget for evaluations at the beginning of the project? How did you manage it?
Yeah, when we talk about the budget related to any project, so as we should say that we are technical support partner of government, and we are committed to provide free of charge services to government. It's our duty to provide evaluation from our side to government to show the impact of the project and to enable government to scale up at the larger area after having a small study. So it's become our responsibility while having the evaluation. So in terms of fund, we have to generate fund from by our own from whatever sources we have for funding. Actually.
Thank you so much for those explanations and for being with us today live from India, from Udaipur. It's a great, great pleasure to have you live from India today in this conference. Please stay with us a few minutes. Yvette, je vais vous poser la même question. L'évaluation, il faut aussi dire les choses. Un coût aujourd'hui qui doit payer ce coût pris en charge dès l'amont du projet, ou vient-il se rajouter lorsqu'un projet est déjà en cours de développement?
Non, c'est quelque chose qui doit être dans les budgets du projet.
Well, I think that the assessment should be budgeted from the onset. This is something that we need to take into account because it is important for all stakeholders. Again, we ask our funders to fund the project, but to also fund the subsequent audit. Do they do that from the start? Are they ready to finance? Are they ready to dedicate a share of the project to the assessment? And so, well, some funders do and others don't. Well, some, we understood that. Anis, I'm going to ask the same question. Who should pay for the assessment? Should it be an independent government? Should it be a funder? Should it be an NGO? Should it be a budget from the start?
I agree with Iveth that those who implement should include evaluation as part of the budget. Whoever, either from the government, either from the non-government institution, organization, either from the university, they should put the budget on the proposal during in the beginning. But then from the perspective of my country, especially Indonesia, some innovation, especially from the local government, district or province, sometimes they do not have similar understanding, especially innovation that also a long-term, several years, and also the budget are also not for 1 year. Sometimes those who taking over the innovation in the next year, they do not know that they should include also the budget for the next term. So I think this is important that we need to have a similar framework about evaluation, because evaluation should start either from usability. Sometimes the prototype already start and then just only small users, but getting more and more, scaling up, widespread. So the evaluation probably in the higher level, in the regional. So I think the communication about budget is especially important for a country where they have a decentralization policy. The innovation start from the lower level government. So I think it is important to communicate about any evaluation, especially the successful implementation that are aiming to be startup and also in the national level. But also we need also to consider about that not all digital health innovation will be successful. If the innovation are not successful, what else, what we need to do? For example, the evaluation, and then we need also to prepare the exit strategy on how to prepare everything, all investment, and also other impact as well. So I think because sometimes in several countries, any innovation and then ended by what? Someone going to the jail. Someone going to the jail because of the innovation are not part of that. So I think I'm very, we need to call that evaluation should be part of the beginning, and then all leaders should know about that, and also all implementers should also involve about the evaluation. And also the coming of, for example, from the research perspective, participatory action research or implementation research is also very important. Many studies, especially in Indonesia, about digital health innovation, we have just started the review about last week. We know that the call of, for example, this implementation research is very important, especially the situation of pandemic. It is not possible to have, for example, case control study or any intervention study. So, I think.
Merci Anis de nous rappeler effectivement que l'évaluation doit être dès le départ du projet.
Yes, I think I agree. I think it has to start at the very start of the project. And I think that you're opening up another window, another issue, because you've said we have to be prepared at the very start of the project, but we also have to assess the failure, the possible failure of a project, because sometimes there might be a financial impact, human impact of a project which can fail, and also an impact with respect to the healthcare. And I would like to thank you, the three speakers we have here, but also our friend in Rajasthan. And I think that we could maybe take advantage of the very last minutes we have for this session to see if there are questions in the audience concerning the assessment criteria, the capacity of understanding what's going on in the field with the teams, and what about the design of the project and also the funding problem. We have our friends from India here in live, and we can ask questions to them. So there's a mic here for the audience, but just before we ask these questions, we have reactions here from our internautes. I'm going to Aguillou, who from a distance thanks the team of the PFAP Foundation. He's in the Bamako University, and he has been, and Mariama from Guinea, thanks us for all the information we have just provided him with. Radzak, who says that the sustainability of the e-health process is a real challenge in southern countries, especially when we know that very little money is usually allotted by the government to this project. There are other questions we can cover, but I think that we also have questions from Thailand, in Bangkok, Dr. Bunjai. Now, Dr. Bunjai, I would like to know, how do you feel about this first session we've had this morning and concerning the assessment of these projects?
Hello, can you hear me?
Yes, that's great.
Okay. Congratulations for the first panel. There is quite a technology grid, and then we cannot listen to the conference throughout the the period of the discussion. But in terms of the evaluation, I have some kind of I have some comments on about the evaluate or assessment. It seems like what we discuss is more on the innovation, like the application. How well I think the foundation that has been really difficult to evaluate within 1 year. For instance, if we would like to have the interoperabilities, building the standard and also gather people to understand the important and also adopt the standard, it takes time. So maybe we can evaluate the success of the program by how well they adopt or they comply to the standard, which is be able to scaling up the projects. The evaluation of economics and also the number of the impact is also important. So another point for the investment is that is it possible that the donor to not just evaluate the application, innovation, or the system, but also invest it in the foundation, like our friend from the Transform Health and from AeHIN, Anis, talking about the foundation, like the governance and the leadership, how the projects contributed to building the leadership and the collaboration between stakeholders in the country to be impact to the long run of the e-health, transforming e-health in the country. Thank you.
Merci, Dr. Bounja. J'ai envie de rebondir sur
I would like to
vos
pick
propos,
up on
votre
what you've
remarque
just said
auprès d'Anis,
with
justement en
Anis,
termes
because
d'évaluation.
Anis is
Le
here
Dr. Bounja, il nous
what
le rappelle
about
à très juste titre
Professor
que
Bounja has
l'évaluation
said
demande
that
du temps, tout
evaluation
simplement
requires
parce que les
time.
personnes
It's
concernées
time
par le
consuming
projet
because you have
ont
very many
besoin de
people
temps pour
involved
s'approprier le
in a
projet.
project,
Est-ce
and
que c'est pas aussi un
therefore,
piège dans ce
isn't
monde du
this
digital qui va
a
très
problem
très vite,
because we have
où on a
a
des chiffres
fast
d'utilisation
running
très très
environment
vite,
when you are in the
d'être
digital
piégé, de se
environment? Everything
focaliser
goes so
sur ces
fast.
chiffres
So how
immédiats
can we do
et de
that?
ne
I
pas
mean, how
laisser
can
le
we
temps
evaluate? Because
au
we are in
temps.
numbers, but we need time, don't we?
Thank you, Dr. Bunchai. I think when we discuss about evaluation, sometimes we also mention about short-term evaluation that should also come soon after any innovation or any implementation. Sometimes the result will be appeared after several times, midterm evaluation and also long-term evaluation. But I agree with you that we need to put the importance of evaluation for any implementers. And the call of Dr. Bunchai about investment, I think this is the question to Mathilde, I think. But I agree with you, and also part of AeHIN, we agree with you about the importance of evaluations. And also I agree with you that sometimes the digital health innovation, not the technologies, for example, the standard. I think the essence is also how to bring people awareness. Because implementing the interoperability, implementing the standard, it also takes long. And sometimes regulation should be there. So if we just calculate it from the adoption of technologies, probably easier compared to others. But then for this aspect, the soft part of technologies, it is rather difficult. So it is the time that socio-technical approach for any evaluation is very important, not only from the technological aspect, but also socio-perspective aspect is also important.
Des questions depuis cette salle. Allez,
Now,
on va
I don't know
porter
if we
les
have
premiers
questions here in
micros. Je
the
voudrais
audience,
vous présenter, s'il vous plaît, quand vous posez la question. Puis poser des questions assez courtes, comme ça on va faire circuler le micro parmi notre panel assez rapidement.
Bonjour, et merci pour la parole. Donc, je suis Sébastien, je suis le fondateur de IT for Life. On parle d'évaluation, d'évaluation notamment financière. Et encore une fois, je pense que quelque chose qu'on oublie, c'est pour pouvoir faire ça, il faut des compétences et il faut encore une fois des outils. Dans les sièges,
let's not forget that. And also in the field, of course, not only in the organization, you have to manage the budget, and you need skills for that. And we are more technical when we speak of assessing these projects from a technical, financial point of view. We are looking for skills for that. We need new profiles, and if not, we will never be able to do that if we don't have more investments. I think that private companies are dedicating up to 10% of their overall budget for digital tools and developments, and we sometimes less than 1 and sometimes less than 0.5%. So we can't continue like that. We really have to react, and I think that we have to allot more budget to that. We need experts, we have to train people, we need more technicians, and I think that Terre des Hommes is a very good reference for us, because I think that the budget that you have been devoting to the EIDA project is probably not the one that you have been devoting more recently, because you have to find skills. And you said yourself that you have to discuss with the Gates Foundation and make sure that you find the appropriate profiles. But that's not something you're going to find so easily. You're going to have to pay for that. And for that, you need money, of course. Thank you.
Yvette, justement, ouais, c'est imaginable aujourd'hui dans un
you think that in a project today I'm going to dedicate 5 or 10% of my overall budget?
Ça marche normalement, ouais.
Tout à fait d'accord.
Yes, I completely agree with what you've said. I'm completely in line. And I think that we should not forget the way we do this, because Terre des Hommes, what do? We have a partnership with the academic environment, universities. It's not something that we have done on our own, okay? And the positive aspect is that we have external audits or evaluations. For instance, when we have a conflict of interest, what we have to try to do, how can an outside auditor will be able to do the evaluation? New university, for instance. This is a funding which is part of the project. You always have to embed this in the project. I agree. Joy.
Thank you.
Yes, it works.
Yes.
Just wanted to comment one. Usually it is said that if you cannot measure, you cannot manage. And any programs, like if we have these parameters defined typically in the beginning as a baseline, then it is easy to assess or evaluate. Usually many of them don't do. But I have one particular program that one of the first e-health program, multi-country program that was in Asia, that is Pan-Asia, supported by IDRC Canada, where we had this formative evaluation in the development phase. And then at the end of the project, we also had this summative evaluation. But it was very structured. So any comments on that, like whether such evaluation efforts work? And then how do we actually define the success? Because it's very important to define those. If you do not define what is a success, then it's going to be difficult to actually evaluate. Thank you very much.
D'autres... Voilà, Madame.
Yeah, more questions here in the audience. Madam, you have the floor. Valériane Leroy. I'm working at the INSERM Institute in the field of research. Thank you very much for organizing this meeting. It's a great pleasure for me to see that we are really improving from one year to another in the organization of the e-health program. Now, I have a question concerning the assessment or evaluation. I think that it's really important to start with upstream, but also you need money for that. You need partnerships like universities or independent entities. I think this is really essential. It has been said, but I think it's also important to have not only an operational evaluation, and that you have to try to understand if the project is going to be successful and why it's going to be successful. If it's not successful, why it's failed. I think that's important not only for the people who are implementing the project, but also for the funders, for the donors, and it's important also for the governments, because they have to be involved in a project. And it's also, as you said, time-consuming. We need more time. We have tried to understand what the whole process is all about and how we can have a sustainable project. Very often the donors, the funders are looking into the expenses we have, and very often we have to stop the project because they don't want to fund anymore. So we have to go beyond these limits, and I think that every everybody can understand this.
Merci de le rappeler, effectivement, ces différents
Thank you. I
prismes
think
regard
that we have different
sur
approaches, of
l'évaluation
course, when it
peuvent
comes to
vraiment varier d'un
evaluating or
intervenant à
assessing a
l'autre. Il y avait
project.
d'autres
Now,
bras,
do
voilà,
we
monsieur.
have other questions here in the audience? Yes, I think there's one here just in front. I'm in a project manager and we're working with the EAD project in some countries. My question relates to the funding of the evaluation of the assessment, who should be normally upstream. It should be included at the very start in the project. Okay? Now, if we're speaking of a research protocol which has not been completely prepared and you already have the funding, you see, when I speak of a research protocol which will develop afterwards and which will have to take into account different aspects, my question would be, how are we going to adjust and adapt the budget afterwards once you have started developing the project? So shouldn't we have some flexibility so as to be able to discuss with the funders, the donors, as to adapt the budget? Now, who is going to do that? Because when you are in research, I mean, things develop and after the funding. Iveth, maybe could you say a few words about this and react?
C'est compliqué.
It's a bit complicated because if you start with a research project which is going to evolve and change, well, you're always going to have to find new funders so as to cover the costs. I know that's not so easy, so that means that you have to be flexible and agile. Now, I think the adjustment is one of the mechanisms you need, because if you have a first investment when it concerns the implementation of the project in the field, you have to continue developing the project. You're not going to stop research either because of that, you see. So it's complex.
Mathilde, vous vouliez compléter?
Mathilde, maybe you would like to say something.
I'm not a researcher or an evaluator, but I just want to share that I think similarly to the approach we are taking to investment in looking at better coordinated and increased investment for digital health, I also think that we need to look at ways to evaluate in a more coordinated manner. And so I think, for example, when we are evaluating, like Jai said, much longer term impact when it comes to digital health transformation, for example, we need to look at those changes over a much larger period of time. At the moment, the issue is that we are evaluating everything on a very project basis, and this is causing the pilotitis that we're currently seeing. So I think both in funding and in evaluation, we really need to look at these longer term kind of investments as well as the way that we measure the success.
Rassembler les contraires, à la fois
yes, bring together flexibility and be able to adapt the evaluation, but also be able to work on very long periods. Now, more comments? You have a comment? Yes, good morning. My name is Delphine. I'm a senior partnership in the Mali project. I would like to ask a question concerning randomized studies. I would like to know how you can convince governments or the private sector and the academic environment to invest in some of these projects. It's not enough to have monitoring and evaluation as we traditionally do. For instance, with DMAGI, where we are developing healthcare products. We are a huge platform. We've been operational for more than 20 years now. We have a massive rollout of our products in India, and we have only one RCD. So how can we convince people so as to make sure that we will get more funding? Because that's the real problem. I think that's really crucial. That's the hotspot. Maybe Anis, could you react concerning randomized
It is interesting, and also it's also difficult to answer, because the RCTs for any digital health innovations, it is also different from the context. We had in our setting mobile health innovation for patients with tuberculosis, but for RCT we start with to select randomize a patient with TB coming to the hospitals, but then we need also to develop the protocol on how to select someone to choose the mobile applications, and the other one with the mobile application, but not a specific apps, for example. So developing this kind of RCTs, I think we could start from the good clinical practice. Sometime in the regularly setting in university, we teach students and university about how to conduct a good clinical research practice, and also RCTs are also part of that. And based on that concept and principle, and then we apply how the mobile health innovation could be part of the RCTs. But then the question about the numbers, about the money, for example, it also depends on how much impact that we need to be received from the implementation. Because later on we discuss about how many samples that we need to be involved in the settings. And also, if we would like to have, for example, multi-center studies, more hospitals to join, that also will be implicating the budget as well.
On avait le docteur Bunjai qui nous suivait tout à l'heure à Bangkok. Il y a plusieurs
Bunjai in Bangkok, but we also have other campuses connected with our observatory. And let's go now
l'heure est déjà avancée, la journée est déjà bien avancée aujourd'hui. Je propose de partir sur deux continents où la journée est moins avancée, qui se préparent à nous suivre, notamment cet après-midi. On va partir à Dakar, retrouver tout de suite normalement Michel Namar qui est sur le campus de Dakar. Bonjour Michel, quelle heure est-il à Dakar? Est-ce que les personnes commencent à arriver petit à petit sur le campus?
Allô, oui, bonjour.
Yeah, hello.
On vous entend. Alors, c'est pas Michel Namar. Qu'est-ce qui nous reçoit aujourd'hui à Dakar?
Who's there in Dakar?
C'est Madame Den Aminata, responsable du campus numérique.
Aminata, I'm in charge of the digital campus
alors,
in Dakar.
Qui est-ce qui va venir aujourd'hui assister à cette journée depuis le campus de Dakar? Est-ce que ce sont des étudiants, plutôt des soignants? Qui est-ce qui se prépare à venir?
Il y a le doyen honoraire,
the dean will be here, Professor San,
voilà. Je vous laisse.
And he's going to take over from me.
Bonjour.
Good morning.
Bonjour.
Hello.
Bonjour.
Hello, everybody.
Est-ce qu'aujourd'hui, alors qui est-ce qui se prépare à venir tout à l'heure à Dakar assister à cette conférence de l'Observatoire d'e-santé dans les pays du Sud?
Alors, c'est vrai que je viens, personnellement, je suis le doyen honoraire de la faculté de médecine.
I'm the dean of the pharmacology and medicine school. There are other colleagues who will join this afternoon. For the time being, they have not arrived. We feel very privileged to take part to this event because we're very interested in e-health. You know that in Dakar we have a number of digital projects. We have projects with a number of partners, public and private stakeholders. And of course, we're very interested in any learnings. I think that e-health, there are projects around the world, and I suppose that there are interesting learnings for us in matters of, again, success criteria, but also the different types of projects that exist around the world.
En tout cas, écoutez, Monsieur le Doyen, ça nous fait chaud au cœur de voir que le campus de Dakar se connecte aujourd'hui, comme chaque année d'ailleurs, à chaque édition, à cette conférence de l'Observatoire de la e-santé dans les pays du Sud. Merci d'être avec nous. Je sais que vous allez écouter avec beaucoup d'attention ce qui va se dire cet après-midi. C'est donc la fin de cette première partie de la conférence 2022 de l'Observatoire de la e-santé dans les pays du Sud. On va à présent marquer une petite pause et on se retrouvera tout à l'heure à 14h30 heure de Paris, 12h30 temps universel. À tout à l'heure à tous.